Last Friday's Echo had a good story about Alder Hey Hospital. Pioneering Alder Hey Children's Hospital is today launching a life-saving initiative which will see it leading the way in global paediatric care. Its new International Child Health Department, the first of its kind in a paediatric hospital in the UK, will coordinate the existing humanitarian work carried out by Alder Hey staff. It aims to save the lives of children and promote health in under-resourced countries by assisting in research, education and development. Its director, Professor Barry Pizer, who is a consultant paediatric oncologist, said, "Our vision is that Alder Hey will contribute to improving the health of the world's children, building our international reputation and leading the way in paediatric healthcare." Staff at Alder Hey have been using their skills to help children in developing countries who may not otherwise have access to free healthcare for more than 20 years. Alder Hey already has an established partnership with Kanti Hospital in Kathmandu, Nepal, the only dedicated children's hospital in the country, which has a population of 30 million. Staff have been making regular trips to provide assistance for more than a decade, sharing their expertise in paediatric life support and resuscitation, cancer treatment, burns surgery, and the treatment of epilepsy. Professor Pizer has been supporting the Children's Cancer Unit for more than 20 years, training doctors and nurses, providing support in the care of individual patients, and introducing ways to improve recovery and reduce mortality from the toxic effects of chemotherapy. Cardiac surgeon Ram Danapaneni has been leading teams at camps across India and Africa with the Healing Little Hearts charity, performing successful surgery on children who were previously believed to have inoperable conditions. And consultant plastic surgeon Shan Falda has trained nurses, surgeons and physiotherapists in Nepal in essential burn care. Research studies have taken place in Malawi to help community health workers better identify children with disabilities, and Louise Hall, clinical nurse specialist for cleft lip and palate, has volunteered her time for the past 9 years to run a post-operative ward in India with the Northern Cleft Foundation. And in a week, UK cleft surgeons, including Alder Hey consultants Chris Sweet and Simon Van Eden, operate on between 80 and 115 babies and children born with cleft lip and palate. Meanwhile, Callum Semple, respiratory consultant at Alder Hey and Professor of Child Health and Outbreak Medicine at the University of Liverpool, led a World Health Organization mission to Sierra Leone during the Ebola crisis in 2014. Professor Pizer added, "These placements not only benefit patients, they also help with the development of staff. They return to Alder Hey with more advanced skills for the benefit of our young patients in the Northwest."